Imagine waking up every single day feeling like you didn't sleep at all. You're not just tired, you're completely drained. Modern research now tells us that this is not just fatigue, but a very, very serious issue. Scientists believe now that MECSF is a real physical illness that affects the immune system, the brain, the nervous system, blood flow, and the body's ability to make energy. I'm Dr. Gary Kaplan, founder and medical director of the Kaplan Center for Integrative Medicine. Today, we're talking about a condition called MECSF, which stands for Myalgic Encephalomyelitis, chronic fatigue syndrome. Imagine waking up every single day feeling like you didn't sleep at all. You're not just tired, you're completely drained, like your body's battery never recharges. You try to push through, but even small tasks, taking a shower, answering an email, can leave you completely wiped out, not just for an hour, but for days. Your mind feels foggy, words slip away mid-sentence, and the harder you try to function, the worse your symptoms become. There is no pushing through. Worse, you go to your doctor and you're told it's just stress or burnout or that you need better sleep. If you're living like this or watching someone you love disappear behind this kind of exhaustion, you need to hear this. It's not in your head. You're not lazy. And what you experience is real, and it's a real medical condition. In 2013, Dr. Sebelius, who is head of Health and Human Services, appointed me to serve on the MECSF Advisory Committee for Health and Human Services. I served on that committee from 2013 until 2017. MECSF was not even acknowledged as a real disease when I first started on the committee. It wasn't until 2015 that the Institute of Medicine, now known as the National Academy of Medicine, and the NIH finally said, yes, this is a real disease. Modern research now tells us that this is not just fatigue, but a very, very serious issue. Scientists believe now that MECSF is a real physical illness that affects the immune system, the brain, the nervous system, blood flow, and the body's ability to make energy. So in this episode, we're going to talk about what MECSF is, what may cause it, how to diagnose it, what other illnesses need to be ruled out, newer testing options, treatments and supplements that may be of help. The truth is, this is a complex condition that doesn't show up neatly on standard lab tests. There's no single biomarker, no quick scan that says, this is MECSF. And in a medical system trained to look for clear, measurable abnormalities, patients with very real, complex symptoms often fall through the cracks. What we're seeing is a breakdown across multiple body systems. The brain, the immune system, the way your body produces and uses energy. This is not ordinary fatigue. And this is exactly why it's so important to work with a provider who understands how to look at the full picture. Because if you're only looking at one symptom at a time, you're going to miss what's actually happening. So MECSF is much, much more than feeling tired. The main symptom is something called post-exertional malaise, or PEM. That means that even a small amount of physical or mental activity can cause a major crash later. I had one young man I worked with who, after doing 10 minutes of reading, studying, would completely crash for the rest of the day. We had to back him off at 5 minutes and then take an enforced break for 20 or 30 minutes, which would allow him to continue to read at 5-minute intervals. He's now successfully gotten through college and is doing quite well. A person may feel okay during their activity, but hours or even days later, they can suddenly feel much worse. Symptoms may include extreme, debilitating fatigue, brain fog, difficulty, focus, and concentration, body pain, dizziness, lightheadedness, trouble sleeping, extreme sensitivity to light or sound, and flu-like feelings. Many people say the illness started after an infection, such as Epstein-Barr virus, mono, the flu, Lyme disease, and most recently, we've demonstrated its link to post-COVID-19. One of the most frustrating things about MECSF is that symptoms can fluctuate dramatically. One day, a patient may feel relatively high functioning and completely wiped out the next. Patient can also go for series of days feeling relatively normal and then completely bedridden. The unpredictability is not completely random, but can certainly appear to be. It often reflects how much stress the system has accumulated, because in MECSF, there's a reduced threshold for overload. That means that things that most people recover from quickly, like a busy day, a short trip, or even emotional stress, can push the system way past its limits. And once that threshold is crossed, symptoms intensify. To understand MECSF, we need to start with the brain and the immune system. There's a concept called central sensitization. In simple terms, it means that the body's alarm system is stuck in the on position. But in MECSF, it's not just about pain, it's about the entire nervous system becoming hypersensitive. Light, sound, physical contact with lots of people around you in a crowded environment, minor activity, everything gets amplified. Now let's go deeper. Inside your brain, there are immune cells called microglia. And indeed, I wrote an entire book on this called Total Recovery about 10 years ago. The microglia are the kind of first responders. They're the white cells in your central nervous system, monocytes. They're supposed to activate briefly and then shut off, and they're part of the repair process anytime there's neuronal injury. But in MECSF, they appear to stay chronically active, releasing inflammatory chemicals that disrupt normal brain activities. This creates a feedback loop. Immune activation leads to brain inflammation, which dysregulates the immune system further, which then activates the immune system. Research shows these changes in the brain and nervous system. Brain scans in some patients show changes in blood flow, changes in brain connection. Now, what that means is that the brain isn't an on-off response, but rather what happens is the brain is a symphony. And so a whole series of centers in the brain have to coordinate in activity in order for you to respond in any way. At its core, MECSF is an energy crisis. Your brain can no longer reliably produce or regulate energy, and that changes everything. To understand this, we need to zoom in on the smallest functioning unit of your body, your cells, and specifically inside the cells, the mitochondria. The mitochondria are the energy producers in the cell. Their job is simple but essential. Take the food you eat, take the oxygen from your blood, and convert it into usable energy. That energy is what allows you to think, move, regulate temperature, repair tissues, everything. But in MECSF, something goes wrong in that system. Not necessarily in a way that destroys the mitochondria completely, but in a way that makes them inefficient, inconsistent, and stressed. Some MECSF studies show problems with ATP production, which is what the energy cells are, the energy chemicals that the mitochondria produce, in energy metabolism, and recovery after activity. This may explain why patients often feel like their body cannot recharge properly after exertion. And remember, when we talk exertion, we may be talking about spending a few minutes just concentrating and focusing on something such as an email or reading, or doing a small activity such as morning hygiene. Researchers believe the body may struggle to recover normally after stress or activity. You may feel okay for a short window of time and then suddenly hit a wall that feels like your entire system just shut down. Again, this is not normal fatigue. This is a failure of energy regulation, and it's one of the reasons patients often describe a very confusing pattern. I can do something small, and it feels fine in the moment. But later, sometimes the next day, I completely crash. The delayed crash is one of the most important features of MECSF. It's called post-exertional malaise, or PEM. And it's not the same as being tired after activities. It's a system-wide collapse in function that happens after exertion. Now, exertion doesn't just mean exercise. As we've said, it can be a short walk. It can be just getting up in the morning to shower and brush your teeth. It can be a phone call. It can be a grocery trip. Even sustained concentration or a relatively mild emotional stress can cause a crash. For a healthy system, these are manageable inputs, but for someone with CSF, they can act like complete overload signals. And the result isn't just fatigue, it's full body shutdown. Patients describe it as feeling like they've been hit by a virus, severe exhaustion that rest does not fix, cognitive slowing or inability to think clearly, increased sensitivity to light, sound, and movement, and in many cases, a return of these flu-like symptoms, these kind of generalized body aches. And importantly, this often appears 24 to 48 hours after the triggering event. That delay is key because it tells us that it's not simply a lack of fitness issue, it's a biologic response pattern. Now, it can happen much faster than that, but the fact of the matter is, this is why exercise can make symptoms much worse. You need to pay attention. Pacing, not pushing. Patients are often told to push through the fatigue, but in MECSF, pushing through does not build capacity. It often causes the opposite. In MECSF, activity can trigger inflammation, nervous system stress, poor blood flow, and worsening fatigue. That is why many patients need to carefully manage their energy levels. Now, another critical misconception in MECSF is sleep. Many patients are told, you're just not sleeping well. But what they describe is very different. They may sleep for 8, 9, even 10 hours and still wake up feeling not rested at all. This is called non-restorative sleep. And it happens because sleep is not just about duration, it's about what the body is able to do during sleep. In a healthy system, sleep is when your body repairs tissue, resets immune signaling, restores brain functioning, and recharges cellular energy system. But if the underlying energy systems are disrupted, then sleep becomes incomplete. So the patient sleeps but does not recover. Over time, this creates a dangerous cycle. Low energy leads to reduced activity, which leads to sensitivity to exertion. Then you crash and you have an even lower energy. It's not a psychological issue. It's a physiologic dysfunction. Many people look at this illness as a moral failing. It is not in any way, sense, or form a moral issue. It is a physiologic issue, and you truly need to understand that you or your loved one is really very sick. And when we understand that MECSF is fundamentally about energy regulation failure, we can stop finally labeling laziness, depression, or burnout. Now, there's one more important layer here, because energy failure in MECSF does not stay confined to the body. It directly affects the brain, and that's where we move next, into brain fog, cognitive functioning disruption, and neurologic consequences of energy consequences. Now, let's talk about one of the most important and confusing and distressing parts of MECSF, which is brain fog. This isn't just about being a little forgetful. It's not aging or stress. What patients are describing is a real reduction in how efficiently the brain can process information and recall. Many people say things like, I lost my word in mid-sentence. I can't follow conversations the way I used to. It feels like my brain is slow, like it's buffering. And what's important to understand is this. The brain itself is not damaged in the traditional sense. Instead, it is operating under resource constraints. Remember, we said that energy production is unstable. The brain is one of the most energy-demanding organs in the body. So when the energy available drops or becomes inconsistent, the brain starts to prioritize survival functions over higher-level thinking. That means attention becomes harder to sustain. Word retrieval becomes less reliable. Processing speeds slow down. Multitasking, a near impossibility. It's not a loss of intelligence. It's a reallocation of what is now limited resources. Now, layer on top of this energy issue, there's another important factor, neuroinflammation. When the immune system of the brain is persistently activated, as we discussed earlier about the microglia, it doesn't just affect how the body feels, it affects how the brain processes information. Think of it like trying to think clearly in a room that has much too much background noise. Everything still works, but nothing works smoothly. That combination, low energy availability plus ongoing neuroimmune activation, is what produces the experience of brain fog. So when we put this together, brain fog and MECSF is not an isolated symptom. It's the result of multiple overlapping processes: reduced cellular energy supply, ongoing immune system activation in the brain, and a nervous system that is stuck in a heightened sense of sensitivity. And that combination explains why patients often feel like they are not themselves. Because when the brain cannot access stable energy and stable signaling, even basic cognitive tasks become difficult. Now that we understand how MECFS affects both energy and brain function, we need to talk about something equally important: why so many patients are told the wrong diagnosis, and why standard treatments often fail to help. There's currently no single test for MECSF. And many patients, this is where the frustration really begins, because they've gone through multiple evaluations, they've seen multiple specialists, and they've tried multiple medications. Yet the core problem remains. The reason for this is not that the providers are ignoring symptoms, it's that most modern medicine is built around a different model. It's very effective at identifying and treating infections, structural injuries like a fracture, hormone imbalances, clearly defined inflammatory diseases. But MECSF does not fit neatly into any single category, and it's not primarily a structural problem. It's not a problem of a mood disorder. It's not a single organ disease. It is a multi-system regulatory condition. Now, what happens is when we apply a single system treatment to a multi-system problem, we tend to see only the partial or temporary improvement, if any. For example, many patients are prescribed medications intended to address sleep disruption, anxiety or mood symptoms, pain sensitivity, fatigue. And while these medications may help certain aspects of how a patient feels day to day, they often do not address the underlying drivers: immune system activation, overactivation, neuroinflammation, mitochondrial energy dysfunction, and nervous system hypersensitivity as a result of an inflamed brain. So the core cycle continues underneath the surface. This is also why some patients are told their symptoms are due to stress or deconditioning. But when you don't see a clear abnormal lab result or structural finding, the default explanation often becomes psychological or functional. In MECSF, what we're actually seeing is not a lack of effort or resilience. It's a system operating under chronic biologic strain, but they're not ultimately going to address the underlying problem, the root cause of your disease. That's why many patients feel like they're managing symptoms, but not actually improving their underlying conditions. As I said before, another factor that can complicate the picture in MECSF often overlaps with other conditions. For example, patients experience widespread pain consistent with fibromyalgia. But even then, it's important to recognize that MECSF and fibromyalgia, while related, aren't identical. They can share overlapping mechanisms, but they often require a different emphasis in treatment. That is part of why these conditions are so frequently misunderstood or grouped together incorrectly. And that is exactly why a systems-based integrative medicine approach becomes so important. One that looks at the immune system, the nervous system, the cellular energy systems together rather than separately. Because when you start to view MECFF through that lens, the pattern becomes much clearer and less mysterious. Some doctors use more advanced testing to look for immune nervous system problems. These tests are still being studied and not yet completely standardized. Things like cytokine testing. Cytokines are immune regulating chemicals. Some studies show abnormalities in cytokine levels in people with MECSF. But results are inconsistent, and there's no official cytokine test used to diagnose the illness. Doesn't mean it can't be helpful, but still gives us insight as to what's going on in immune dysregulation. Cell Trends is a specific test that looks for antibodies that have been identified in MECSF patients. So looking at a Cell Trends panel will help us identify antibodies that may affect blood vessels, the autonomic nervous system, and heart rate regulation. Some researchers think these antibodies may play a role in postural orthostatic tachycardic syndrome, long COVID, as well as MECSF. But this testing is still considered experimental by many experts. Treatments are available, but there is no specific cure for MECSF. Doesn't mean that people who have MECSF can't get cured, but there is no specific cure, and there's probably subtypes of MECSF, and we're better at treating some of those people than we are at others. Treatment usually focuses on managing symptoms and improving quality of life. So if MECSF is not a single symptomatic condition, and instead involves the immune system, the nervous system, and cellular energy regulation all interacting together, the next question is, where do we even begin to help the body recover? The most important shift in thinking is this: we're not trying to force the body to function. So when we talk about treatment in MECSF, we generally think in several key areas. We want to calm the overactive immune response, particularly the type that affects the brain, and the nervous system. When immune signaling remains chronically elevated, it keeps the body in a permanent state of threat response. That can contribute to fatigue, cognitive dysfunction, and sensory sensitivity. The goal here is not to suppress the immune system, but to help regulate it back toward balance. We also want to support mitochondrial and cellular energy, because energy dysfunction is central to this condition. We also want to focus on improving how cells generate and use energy. This can involve nutritional strategies, metabolic support, and identifying factors that may be interfering with normal energy production. Again, the key idea is not more stimulation. It's improving efficiency and resilience at the cellular level. Third, we want to stabilize the nervous system. Many patients with MECSF are in a state of chronic physiologic high alert. Even when they are resting, their nervous systems may not be in full recovery mode. So part of recovery involves helping shift the body out of that constant stress response toward a more regulated baseline. This is not about mindset alone. It's about the biology of the autonomic nervous system. Next, we want to help identify and address underlying triggers. In some cases, MECSF begins after clear triggering events, such as a viral illness or a systemic illness. For instance, Epstein-Barr virus mono, Lyme disease, long COVID. While not every patient has an ongoing infection, these events can sometimes leave the immune system in a prolonged dysregulated state. Part of a comprehensive approach is evaluating whether there's still an active infection going on, and if so, addressing that helps keep the system stuck. Next, we also want to support the gut-immune connection. We know that the gut plays a huge role in immune regulation and inflammation balance. When the gut barrier or microbiome is disrupted, it can influence systemic immune activity. So for many patients, supporting gut health becomes an important part of reducing overall inflammatory load. In more complex treatment-resistant cases, we sometimes even consider more advanced intervention. One example is a procedure called therapeutic plasma exchange. One of the most important strategies is called pacing. This means staying within your body's energy limits to avoid crashing. Crashing begets crashing and makes the disease much worse. So pacing, not pushing. Treatments may also include working to improve your sleep. Obviously, we always want to be staying hydrated. We want to watch your electrolytes. If you do have post-orthostatic tachycardic syndrome, that has to be managed and treated. If you have things like sleep apnea, that has to be managed and treated. And we need to manage any other autonomic nervous systems. So some patients may benefit from things like compressed stockings, antihistamines. Mast cell treatments are extremely important. Mast cells are part of the innate immune system, and mast cell activation syndrome can create a whole array of problems very similar to MECSF. Medications that help regulate the nervous system can also be extremely beneficial. Immune and antiviral treatments can also help. Treatments such as low-dose naltrexone have been extremely effective for a number of people. Antiviral agents, intravenous immunoglobulins, and anti-inflammatory therapies. But responses vary widely from patient to patient. Unfortunately, no treatment works for everyone. So next, we'll go into more detail about how each system needs to be addressed in order to heal. A simple way to think about this is we filter out and remove a huge amount of inflammatory processes from the plasma. So we clean out the plasma of antibodies, we clean it out of circulating immune complexes in order to reduce the inflammation throughout the entire body and give the immune system a chance for a reset. Think about changing oil that's become contaminated over time or changing the water in a fish tank. You want to be feeding your fish just fine, but if the water is not clean, they won't be healthy. This is not a universal treatment. but it is an example of how we are beginning to think differently about chronic immune and energy disorders. What's important to understand is this. There is, unfortunately to date, no single treatment that cures MECSF overnight, because this is not a single cause condition. Recovery, when it happens, is typically multifactorial and gradual. It involves supporting multiple systems at once and carefully rebuilding tolerance over time. Many patients ask about supplements. There is no supplement proven to cure MECSF, but some may help in certain situations. NAD and energy production, for instance. One popular topic is NAD, which helps cells produce energy. Researchers are interested in NAD because in MECSF may involve problems with cellular energy production. Some clinics offer NAD blood testing, NAD IV therapies, or supplements like NMN or NR, but the science is still developing. Right now, there's no standard NAD test used for diagnosis MECSF, and while some people report benefits from NAD supplementation, others notice no change or even worsening of the symptoms. Some of the more commonly used supplements include CoQ10, NADH, magnesium, omega-3 fatty acids, B vitamins, acetyl L-carnitine, NAC, and D-ribose. These supplements are primarily used to support energy production, mitochondria, inflammation, and nervous system function. People with MECSF are often very sensitive to medications and supplements. If there's one thing I want you to take home from this video, it's this. MECSF is not a psychological condition. Indeed, if you're experiencing some anxiety or depression, it may be because your brain is inflamed. It's not simply about being tired. This is a very serious and frankly very devastating disease for a large number of people. It's a dysfunction across multiple systems in the body, and while it's complex, it doesn't mean it's hopeless. It means we need a completely different way of looking at it, a comprehensive, holistic way of looking at your body. If you've been told it's just stress and to push through, fire the doctor who told you that and move on. Understand that this is a real disease. Pacing, not pushing, is the mantra. And when you understand the biology, you can start changing the trajectory of the disease. In our next video, we're going to take a deeper dive into fibromyalgia and how it overlaps with MECSF and how it's different. I'm Dr. Gary Kaplan, founder of the Kaplan Center for Integrative Medicine in McLean, Virginia. Thanks for watching.